So Tulane University Stroke Program was founded in 2008 to fill a gap in patient care that was needed in our community. Within 2 years, we were a primary stroke center recognized by the Joint Commission, and 3 years later, we were a comprehensive stroke center, the highest level of stroke hospital available. We've been recognized by the American Heart Association for our efforts in taking care of patients with the Get With the Guidelines Stroke Gold Plus Award, which is the highest level award and that is offered, as well as our Target Stroke Elite Plus Award, for which we were the first in Louisiana to achieve this. And what does this mean? This means that we are able to get our patients treated quickly within 45 minutes of arrival, at least 50% of the time. What does that mean? What does that mean by treating? That means that we're offering the standard of care treatments for reversing the effects of stroke, or at least minimizing the effects of stroke, by giving a clot buster that's been shown to reduce the size of a clot and therefore reduce the obstruction of blood flow to parts of the brain that are receiving inadequate flow during that time. The most important signs to recognize for stroke are sudden loss of function, and it can be sudden loss of function involving weakness, so weakness on one side of the body. It might be sudden problems with communication, either with the words coming out slurred or with an inability to produce meaningful sentences or to be able to understand what is said by someone else. Other really common symptoms are trouble with vision, either in one or both eyes, or double vision, or there might be trouble with balance that occurs suddenly, such that the ability to walk is clumsy or the use of an arm or a leg is clumsy. And another common symptom of stroke would be any severe headache, unlike any headache that's ever been experienced before. If any of those things happen, the most important thing is to think time. Every minute matters. To get treatment in time, you have to call 911 so that you can get the fastest on-site evaluation and triage and be brought to a center like Tulane, which offers comprehensive services, so that you can get fast evaluation and treatment in hopes of minimizing the damage. With a stroke, it's estimated that about 2 million brain cells are dying every single minute. So earlier treatment is better. The treatment effectiveness in the first hour is much better than the effectiveness in the second hour, and in the third hour, and in the fourth hour. And really after that, there's no proven benefit of opening up the blood vessel when you're having a stroke. So treatment has to be given as fast as possible, and Tulane offers the fastest treatment in the state of Louisiana. When a patient comes in, the initial assessment involves, do they have deficits that would be disabling for them, and do they have any reason why they cannot get treated safely with the clot buster medication. We have patients that will come in, and because either a family member or somebody in the community called 911, they were brought to our center within the first hour or two from the symptom onset, and within about 25 to 30 minutes, we can get that patient treated with this clot buster. And it doesn't work for everyone, but sometimes it does, and we have a dramatic clinical recovery in front of our eyes. There's nothing more rewarding for our emergency nursing staff or for our residents in training to see, but the impact of their rapid efforts to get this patient treated. To be able to offer somebody another chance to get their life back and live their life with minimal, if any, disability is what we strive for every single day.